Morning class. Today we're going to do lab 2, which is part of the venipuncture procedure, cleansing of the site. So the theory behind this: the venipuncture site must be cleaned with an antiseptic prior to venipuncture. An antiseptic does not sterilize the site, however, it does inhibit microbial growth. Otherwise, microorganisms from the skin can be picked up by the needle and carried into the vein, creating the possibility of infection, or can be flushed into the collection tube on blood flow, contaminating the specimen. The recommended antiseptic for cleaning a venipuncture site is 70% isopropyl alcohol, which is typically available as a sterile pre-packaged pad referred to as alcohol prep pad. Sufficient pressure is needed to remove dirt and debris, not so much as to abrade the skin, especially on infants and elderly patients whose skin is thin and more delicate. If the site is especially dirty, clean it again with another alcohol prep pad. Allow the area to dry naturally for 30 seconds to 1 minute. The evaporation and drying process helps destroy microbes, prevents specimen hemolysis from alcohol contamination, and avoids a burning sensation when the needle is inserted. To prevent contamination of the site, do not dry the alcohol with unsterile gauze. Do not fan the site with your hand or blow on it to hasten drying time. Do not touch the site after cleaning it. If it is necessary to repalpate the vein after the site has been cleaned, clean it again or decontaminate the gloved finger that will be used to palpate. Reagents and equipment that is necessary to perform the cleansing of the site: alcohol prep pads, tourniquet, patient's arm, phlebotomy model arm, and gloves. So we now move on to the procedure. Wash hands thoroughly and put on a pair of disposable gloves. Ask patient to sit with arms in a flat position. Look at both arms on your patient to determine which arm will have the best vein. One arm may provide more accessible veins than the other. Tie the tourniquet 3 to 4 inches above the intended venipuncture site, above the elbow. After locating a good vein, ask your patient to make a fist. Observe your patient's skin for enlarged blue vein. Touch the vein to ensure that the vein springs back like a rubber band. If the vein does not spring back, locate another vein for use. Once you locate an acceptable venipuncture site, the venipuncture site must be cleaned with an antiseptic, 70% isopropyl alcohol, prior to venipuncture to prevent infection. Clean the site with a circular motion, starting at the point where you expect to insert the needle and moving outward in ever-winding concentric circles until you have cleaned an area approximately 2 to 3 inches in diameter. Use sufficient pressure to remove the surface dirt and debris, but do not rub so vigorously that you abrade the skin. If the site is especially dirty, clean it again with another alcohol prep pad. Allow the area to dry naturally for 30 seconds to 1 minute. So class, I'm now going to perform the cleansing of the site on the phlebotomy arm. So we said that what we'll be using to clean the site is isopropyl alcohol 70%. So this is known as the alcohol prep pad. So once you open it. We did indicate a circular motion, so we have the choice of either this vein or this vein, and we are going to start from the inside, and we're going to do circles coming outwards until the actual site is cleansed. The other method that was not mentioned but can also be done is the one swipe method. So once again we open, and once we know either one which vein we're going to be utilizing, we start from the top and we do a one swipe method. So now class, we're going to tie in the two methods. We have the tying of the tourniquet for the actual prominence of the vein, or we can see the vein clearer, and then we're also going to clean the site. So we're going from 3 to 4 inches. We're using the tourniquet that uses the Velcro. Right, so we ask the patient to make their fist, so we could clearly see that her median cubital is prominent. So we're going to clean that side, but once we clean the side, we have to remove the tourniquet. So we're going to open it. We ask the patient to release their fist. Middle, we make the circles, that's it. Then we also showed you another method, which is the one swipe. So it was indicated there, the median, so from the top